right. Hi, everyone. Welcome to ATARC's Predictive Analytics Working Group webinar titled Predictive Analytics, Lessons Learned from COVID and SARS-CoV-2. Before we begin, I do kind of want to encourage all the audience to submit questions if you have any to the Q&A section of the platform, and then we'll kind of answer them along the way as they pop up. I'm going to pass this over to Malaria West, the CEO of Global Accounting. He'll be moderating the discussion today. So Malaria, whenever you're ready. And I know that we are having some technical difficulties with our government panelists, but he'll be on shortly.
Thank you, Nicole. I appreciate it. Thanks everybody for coming out for a great opportunity. Talk about predictive analytics and COVID and how it affects it, not only around with this new variant, but around the world. And I have two great panelists involved. I have Zane Malk from LMI and Shakid, Dr. Shakid from Department of Commerce. And we are wanted to introduce Zane and a little bit about his background.
So thanks, Milo. So I'm Zane Malik. My background consists of, so my undergraduate was in system engineering, master's engineering management, and then focused in my PhD on system engineering around application of agile and rapid transformation. My background focused on, I started off in the commercial aviation environment, and then I switched over to the federal side, going over to Patel and working on transportation security. From there, I switched over to the MITRE Corporation, was there for a little over a decade, started with FAA, then went all around to DoD, DHS. Then currently I'm at LMI, serving as a strategic systems engineer, focusing on digital transformation as well.
I also wanted to thank you, Zane, for your not only your service and helping with this panel. I also want to introduce Shakid. Shakid is he has a great background in predictive analytics and data analyst at the Department of Commerce. Did you want to talk, Shakid, or tell me about the background? I guess he's not on. So I'll tell you a little bit about, my name is Dr. Malaria West, with CEO of Global Accounting. I spent about 11 years in the public domain, GSA directly, and 18 years in the banking industry, doing predictive analytics and accounting overseas, international accounting. And I'm CEO of Global Accounting right now, and mainly we do predictive analytics for a lot of telecom and data wrangling around some of these new up and coming AI predictions and audits. And you have to audit and attest to some of the data. So accounting has changed. So this is a great moment in history for us to consolidate some of the industries. We have a few questions that people have asked and around how predictive analytics and data analytics has changed during COVID and during a pandemic. So the first question is, how has COVID pandemic affected organizations in terms of AI adoption and digital transformation? And since Zane is in this field, it's kind of directed toward him. Can you kind of elaborate on that?
Yeah, sure. So from what we've seen is within our own organizations and then multiple government agencies, everyone's focused in on that. LMI as an organization already went towards a big focus on doing digital transformation, and that came along with all the different government agencies. And you don't always hear that term digital transformation. Sometimes you'll hear digital engineering, digital twin, IT modernization, enterprise transformation. All of that's revolving around the same thing. it's that desire to go to that next step. A lot of times the example I give to people is how about transportation is we were at one point, in our cars driving around, we had maps in our car. And then slowly MapQuest came, and then people sat down, typed in where they needed to go, and then they printed it out and went there. Then along came GPS from their Google Maps, all the way up till now when it's on your phone and you wake up and your phone tells you what time what you have to leave to get to work, and you haven't told it where your house is or where work is. So that's where people are trying to get to. And it's going to be an iterative step too. It's always crawl, walk, run. And people are trying to make these improvements to try to get to whatever their next phase is to do digital transformation. And a lot of that is based on a lot of the issues they run into is based on the type of data they have and what they're trying to do. And a lot of it becomes in this age is they're trying to codify what they really have, and then they can start progressing through that life cycle.
Good afternoon, Mario. Can you hear me now?
Yeah, yes.
Effective. Hi, everyone. I really apologize. I'm having some connection issues, so I'm dialing in for now, and then I will try to connect in about 5-10 minutes as I'm changing location to be able to connect to the platform. But just telling you about myself first. I'm Chief Data Scientist and Acting Associate Director, Office of Data Services at the National Technical Information Service, which is a bureau within the U.S. Department of Commerce. My background is I started as a software engineer at Bull Systems before transitioning to academia, where I had multiple positions as a professor, department chair. My educational background is in mathematics and computer science and data science. And I've been working with NTIS for 2 years now. And I will talk a little bit more about NTIS because it kind of like provide an overview about what we do and the context of what I'm going to say. Because NTIS is a bureau, like I said, within the U.S. Department of Commerce that provides a really unique pathway for federal agency towards innovation and digital transformation. We actually offer an agile and an innovative framework in harnessing emerging and cutting-edge technology, including data analytics, artificial intelligence, to achieve mission outcomes effectively and efficiently. And this framework that we are having at NTIS, which is very unique, it's given to us by a unique authority that was granted by Congress that allows us to enter in partnership with the nation's top private sector companies, academic institutions, and nonprofits to address national data-centric challenges. So what I'm going to share today with you is a reflection of actually multiple projects that we have worked with, including Department of Defense, Health and Human Services, the Department of Labor, Homeland Security, and the list goes on. But just to answer the question that Mario asked about the pandemic, it has been really one of the worst disasters in human history. But the silver lining is that the pandemic, and then according to not just me, but multiple studies, has meant an acceleration in digital transformation and artificial intelligence across all industry, including in the government. Actually, studies have shown that while AI adoption was nearly flat before the pandemic, the momentum has shifted and the need for AI has been accelerated due to the pandemic because of the digital imperative to keep delivering on of the public service that agency have to continue working, but the acceleration of and the expansion of telework and the use of digital assistance and automation. So currently, federal agencies are definitely looking to increase their use of AI and other related emerging technology because of the pandemic, etc. So and adoption in AI has not been seamless. There was a lot of barriers, of course, about the cost of modernizing the infrastructure, the data culture and change management needed to embrace these new technologies, and of course the talent to be able to support and sustain those changes. But the pandemic has hastened the dependence on technology, and then we can talk a little bit more about the what has worked and what hasn't worked in future questions. But thank you for the opportunity.
Thank you, Shakid. So another person, so we've talked about how, and Shakid kind of touched upon this, predictive analytics and data scientists is the industry is increased, tenfold per year, especially during this pandemic. So someone had asked, are you aware of any predictive models used to evaluate any aspects of the pandemic effect? And what types of algorithms have you used for models in the pandemic? So we have so the University of Stellenbosch in South Africa, really good question. University of Stellenbosch in South Africa and University of Melbourne in Australia had collaborated with Hitachi and Samsung and Global County, which the firm that I own. And they looked at studies in Southeast Asia and where pockets are and how different algorithms or models can be used to predict some of this. And some of the classic predictive models that they use is like clustering, forecasting model, outlining, time series models, and things like that. But the best model that they had came up with was something called rainfall modeling, which is that the data sits on top of all subsets and all means and majority of voting. So if you cluster, if you use classic algorithms for both regression analysis, this is probably one of the better algorithms used for predicting that. They also use something called linear modeling. Linear modeling kind of goes back to that tracing and tracing hunting for, who was the last person you were in contact with, where your plane subsets, where, if you take a plane from, right now I'm in Tokyo. And if you take a plane from here to South Korea, you might have to stop overset and go from Tokyo to South Korea. You might have to, might be able to set another place or a layover in, say, for instance, Vietnam or something like that. So wherever you're tracing your pandemic goes through, the linear aggressive model helps you understand how the University of Stellenbosch should help them understand how the pandemic spreads once you touch down for maybe an hour or maybe a few minutes. And it helped them understand what the demographics are and what the people, whether if you're Black, Asian, Caucasian, or you're from Mars or something like that, they want to know how it affects that your ethnic background within that region, and how you cluster it within your own domain. So you have subdomains and domains to help the algorithms adjust in a linear pattern. And they use some of these statistical evaluations like R-square or correlation models to help the linear do the hunting and tracing for some of these pandemics. One of the other kind of when they did these models for tracing and hunting, they started off with some rainforest modeling. It's a kind of a stack model, predictive analytic model that helps you look at boosting or technologies that give you the big bang for your data sets. That worked for certain parts of Asia, but it didn't work. It didn't give them the great models that they use to help predict what's going to predict 2 weeks, 4 weeks, 6 months in that area, whether you're vaccinated or not vaccinated. So these are kind of the models that we used, or the university have used to help illustrate or help get through the predictions of the pandemic. And it's been it's World Health Organization who has helped kind of codify some of these new models that are going around the world, whether you're clustering some of the data that if you're in Europe or Africa or Asia or North America or South America, they help color some of this, the data that helps, going forward. So another key question that was asked, what are the lessons learned on how predictive analytics, AI in general, can be leveraged for effective mission impact? Did you want to take that, Shakib? Number 3.
Yeah, absolutely. I think you get a great, thank you for the overview, Mario, about the different algorithms that have been used. And like you mentioned, there were some breakthroughs and some shortcomings. A lot of models that I have seen were based on the data repository operated by the Johns Hopkins University Center for System Science and Engineering. And the data set was trying to include parameters that can be helpful in tracking COVID, like the location, state, country, the latitude, longitude, as well as, of course, the dates, and then the confirmed or death or recovered cases, etc. And most of the model, like you mentioned, some of them worked well, some of them didn't work as well. I mean, the first models that were developed used regression analysis, which is best suited for this kind of studies, where you have a continuous data set and then we have continuous dependent variable, and that you want to actually predict from those several independent variables. One of the examples that I've seen in the beginning was promising. Was a basic model that collected data across 144 days from January to June in 2020, and used actually a simple polynomial regression algorithm, and it showed an accuracy of approximately 93%. And so, but then give a good prediction in the beginning for July and August, and after that it hasn't worked, and the accuracy went down, and that actually gives some really wrong output. The other problem was also, for instance, in the beginning of the pandemic, there was a lot of effort dealing with COVID detection. So using, for instance, X-ray or CT scan. And I just read a paper recently that looked at all the papers that have been published on the subject during the pandemic related to that, and researchers from Cambridge actually showed that not a single one had really potential clinical use. So it was really a disaster, unfortunately. So to answer your question, Mario, is to say, okay, what are the lessons learned? First of all, I have to say that, epidemic forecasting is really difficult, and we have a dubious track record. So, but for us data scientists and machine learning experts, it was time of reckoning. It was time for us to showcase what machine learning can do, not only in the area of public health, but in other areas. And unfortunately, we came up short. We have to be honest that we came up short with that. So what's the lesson learned? The lesson learned is that we need to have high quality data. We need to use a holistic approach for this kind of issues, and then to be able to actually ingest and clean and analyze data in real-time fashion to be able to do this. And let's face it, when COVID started, we had basic knowledge. We knew about related epidemics, but COVID was something new because of the strength of its propagation, etc. So we didn't have a good track record. So we had poor data input, we have wrong modeling assumption, we had issues with statistic analysis with high sensitivity of estimates, etc. So what can happen in the future is that, and this is something that is true not only for COVID, but for any type of area that we want to study through AI, is data is crucial. Data is food for AI. It's all about having the right data at the right time, in the right place, and with the right person. This is basically the how to summarize that. And then when we started, and AI machine learning is it's still in, it's in infancy. We have, there's a lot of potential there, but we're just learning about how to better feed machine learning models with the right data to get the right results. So that's what we do. So how do we move forward to deal with situation like this? The short answer is that we need to use science and more reliable data. We can choose measures with favorable benefit-risk ratio when we consider together multiple type of impact, not only on COVID, but on health as well as on society and economy and national defense in general.
So I wanted to add one thing and then emphasize another. There is, first one is about making sure that we don't forget that when we're looking at these models and stuff and working on new ones, it's that we focus on the different phases that it goes through. So like, obviously there's one that's before the epidemic hits. So we want to make sure that we're looking at how to have models that are used for planning and identifying the critical issues. And then going into the models for at the start of the pandemic, looking at, that's what we're considering things like where it started, the risk of its spread, how much it can spread. And then finally there's the issue of once it start to spread, it's what can we do about planning for minimizing we can do, planning for the number of medical resources we have, hospital beds, things like that. And then the other part that I wanted to reiterate that Milo and Joao both said was about how we have to look at the data, because at the end of the day, and I always reiterate this, is how important the data is. So first, the first two things are pretty simple. It's, it has to be visible and accessible. We have to be able to get to that data, and then understandable. It should be easily broken down, able to be understood and manipulated. And then next is there has to be a way to link the data. If it's more difficult to link the data, there's going to be data information coming from disparate sources. If we're not able to link it, or it's more difficult, that causes issue. And then next, it's trustworthiness. So you got to make sure you have reliable data that's scrubbed, up to date, and then it just goes into interoperability and security of the data. Those are also key things that you have to make sure that's considered, so that it's not manipulated, it's not used inappropriately, it's well understood.
One of the things that I've, they identified, University of Melbourne had identified was the network which the data comes through. And one of the other working groups that, are kind of partaking in, they talked about zero trust and how the data is, the governance of this data and coming out with the new models, and how Shaki was saying, can you trust the model? Can you trust or can you attest to what is coming out of the pipes? Whether it's your assets, your network, your data policies, or, and things like that. So that's important, that you need to, when you're talking about predictive analytics and some of these new models are, coming down the pipeline. One of the other questions that one of our audience asked is, has the pandemic led to a shift in priorities for agencies in the terms of how they evaluate IT modernization or AI adoption? And can you share some cases of that? You want to take that?
Sure, Mario. I can take that first, and let Zane. And I want to assess what Zane said. I think it's right on point about the data, because very important to make the data accessible, like you said, and understand the data, because that's important. So not only you need to collect the data, but you need to enrich it and label it or catalog it, etc., in terms of the context that you're going to be using it for. Because some of the issues that happened with COVID is that the features that were used were not the right one, and then the data there was also, we got overwhelmed with the data, because so like Zane said, is like you need to integrate that data. To the most value comes from when you connect and link that data together. So in terms of the effect of in general of the pandemic on federal agencies that we worked with is, of course, the first thing that happened is as people started working remotely. So we had some restrictions from the government that had led most of the agency, most of the workforce, the federal workforce, to work remotely. And what's the consequence of that was, of course, an expansion of the digital footprint. And that comes with issues, of course, of cybersecurity. So at the beginning of the pandemic, we had a lot of work with agencies that start like worried about how to ensure that that their network is secure, because and not only the agencies, but the cyber attackers and saw it as an opportunity actually to expand their malicious action. So because of interest of COVID, they try to trap a lot of people through phishing or cyber attacks, or using malicious website related to COVID, pretending to give you like right information on that. So we worked a lot with a lot of agencies that to try to use AI-enabled algorithms and tools to strengthen their cybersecurity defense, their network event detection, and try to actually even go further with some departments, including the Department of Defense, to try to develop some kind of digital behavior or fingerprint of malicious actors. So because to try, that's where AI and ML can, or strong benefit is actually to do augmentation rather than just, so augmenting the capacity of cybersecurity experts to be able to handle all the data that they have to sift through and surface the one that are really need their time. So we worked on that with the Department of Defense to do that kind of work. Another type of work that we that also expanded because of of what I just mentioned, the expansion of the digital footprint of most of the agencies, is of course related to fraud. So most of the organizations so far have been using rule-based systems as the primary tool to detect fraud in their agencies. An example, of course, is Medicare and Medicaid. I mean, we're talking about an $800 billion budget there. And according to the Government Accounting Office, the GAO, if they estimated that improper payment were in the order of $50 billion. So it's a lot of money that is actually taken out of the ability of HHS to actually support actual people that are really needed the healthcare under the Medicare or Medicaid. So we looked at the issue and trying to see how we can use ML and AI to help them better optimize their processes, support and target and help the auditors and investigators in how to collect the information and how to support their investigation and audit, and including from external data. So that has been really like very successful, and then it's still ongoing. So those are kind of examples that come to mind.
So just to add on some more examples and things that I've seen and worked on is one of the simplest things that we always see now is as there are people are adopting more cloud and collaborative environments, you're seeing a shift away from a lot of manual processes that I guess earlier we didn't think were very manual, but emails and phone calls, it's slowly going away from there. We're tracking things in basic Excel and going more towards that collaborative environment. And a good example of that is getting people to switch over to something like where you're working off Teams, SharePoint, and OneDrive, showing them, and then a lot of training on how they can work collaboratively on that. Another example we usually give when talking to people about this that everyone can relate to, that everyone's probably noticed now, is a lot of restaurants that you're going to before, if you were ordering anything, you would call up, place an order. Those same restaurants now have an online process. They'll actually encourage you to do it and order through that. And what that does is it's reducing the manual labor time. So that's people hired, reducing the mistakes that could be made between communication, what was written down. There's a way to completely track that. It improves efficiency and it increases processing time. So same thing happens when you're going from emails to a collaborative environment. It goes from a few days of resolving something to a few hours. If people are in the same collaborative space, they can resolve that issue. And then in the back end, there's a lot of data being captured that can help further along. And a more specific example is about acquisition lifecycle and system engineering lifecycle processes. It's a lot of these in the government space require a lot of manual processes, going through certain documentation, system level reviews, and all these have certain data elements, which you can consider that all the way from a background statement to a requirement to the results of the requirement. And if you're able to pull these out, what you're able to do then is help the user actually prepare the next document, plan for the next document, and generate the next document. And going from there, you go through the whole life cycle of a program, trying to help them along and plan and actually see possible issues. And what that also does is provide up-to-date information for everyone right away. And so you're reducing a lot of labor time, increasing the speed of the acquisition lifecycle and the accuracy. So those are some examples.
And another thing.
Yeah. And
go ahead.
Yeah, Mario, I'm sorry to interrupt. Just to add to what Zane said is also what we have also experienced with as a consequence of the pandemic, which was already a trend going, of course, but we saw also federal agency develop a platform, data analytics platform, by harnessing the cloud, which was really needed to sudden surge in virtual service demand. So the movement to the cloud has been also accelerated because of its very nature. It's more quickly scalable and provide a good way to be able to share data across the agency and across all the programs that the agency is supporting. And like Zane said, there was a lot of course, adoption of automation, and that helped a lot of employees move from low value to high value work, and effectively tackle the spike in demand for critical services. Because we cannot forget that the federal government didn't shut down. I mean, they kept going and trying to provide the service to their mission throughout the pandemic, and it's not always easy. When those things happen and you have a little bit of how to mitigate the risk of trying to actually continue to provide the public service in unusual circumstances, but in a way it helped government be leaders in innovation. We always complain that the government is always behind, but in this case, a lot of agencies have shown their desire to be ahead, to really innovate and use this calamity and this as actually a trigger to move faster towards innovation and adopting the new technologies, including, of course, AI and ML.
Thanks, Shaki. That's really great. To kind of piggyback off of what Shaki and Zane says, there's a few things that I've seen hospitals do. Forecast disease, the severity and the risk, planning for hospital constraints, and the mapping spread of the virus. And it kind of goes off what Shaki said and Zane said. There's a mountain of evidence, when it goes back to what other things does this virus done? Whether it's hospitalization, the beds, what patterns are going from local to state to federal across different ones. So that that's a great point. Another question that came from the questions was, can you share examples of how your organization uses data analytics and AI generation, deep learning insight, strength of evidence-based decision-making, or automate business functions?
So yeah, before I even get into that, this is where another place to highlight, it's about data. And a lot of the places that, a lot of the organizations that want this are realizing that they should have been capturing this data early on. Some of these can be resolved. An example of where you can capture this information now and it works is, for example, we developed a tool called OrgIQ. What it's doing there is looking at an organization, looking at their people's capabilities, and looking at the work that they've gotten before and the work that they're planning to get, and help lay out what capabilities and skill sets that they need to be planning for, which ones they need to be training their current people on, which capabilities they need to be looking at for hiring new people. Because if this pandemic showed anything in a work environment, is people have to be able to adapt, and new skill sets have to be developed, trained, learned, people hired on. And so that helps you plan for that, and then predict what's needed. The other examples where what people are falling short is, if you haven't been able to capture enough previous data, it's hard to go in and now start creating a model or generate an algorithm that can help you predict anything for the future. For example, going back to the acquisition lifecycle piece of it, if you haven't already been capturing the data that's needed to do the prediction, you can develop a model, but all it's going to do is wait for, now you're going to need X amount, hundreds of data points to be filled in before you can start predicting the new what's needed for future programs at different levels. That's just, unfortunately, that's the fact of the matter, that people have to understand is if you haven't captured it, now you have either you have to wait for the new information, or you have to go back to all the information that was probably captured manually, not in one place, and go record that and leverage that to do the future predictions.
Yeah, to add to that, Malio, to answer the questions as far as NTIS is concerned, a project that I will briefly mention is a work that we've been doing with USAID on the President Malaria Initiative. So that can be also useful in terms of any type of epidemics that exist around the world. And there was a lot of talk about COVID, of course, and for the right reason, but we cannot forget that there are other epidemics out there. So the USAID PMI goal is really to control and eliminate malaria across the world. And the key fact is that malaria is a life-threatening disease caused by parasites that are transmitted to people through the bite of mosquitoes. And it's preventable and curable. But in 2019, and this is astonishing numbers when you read them, there were an estimated 229 million cases of malaria worldwide. And there was about 409,000 deaths. And out of those deaths, 67%, which is about 274,000, were children under age of 5. So malaria is actually the world's third most deadly disease for young children between the age of 1 month and 5 years. So the project we've been working on this PMI is literally about saving lives. And so how do we do that? Malaria is, of course, we're trying to find a cure for it. But in the meantime, we have to use the existing resources that here, which are try to prevent that using mosquito nets, looking at the weather, looking at how population are moving from one side to the other, and try to allocate the right resources at the right time in the right place, with of course the limited funds that they have, and try to aim at strengthening the host country system to generate high quality health information and related data that can be used for decision making at the local, national, and global levels to try to reduce the malaria burden. So one of the things that we have had USAID do is design and build, in collaboration with our joint venture partner, build the what we call the MDIVE platform, the Malaria Data Integration and Visualization for Education platform, and that helps basically store and organize malaria-related data across the world. And it's fascinating because you can see that the data comes from structured, unstructured, different languages, different methods of collecting the data, trying to make sure that to clean that data and validate it and put it all together for not only upper level management to make the decision, but also for data scientists to actually analyze and get deeper into the data to try to provide the right information to support the decision that are made to, again, literally save life and provide a better resource optimization for as much as possible. So this is an example of things that ML and AI are able to do. So we cannot, based on COVID, become a little bit more hesitant about adopting AI and ML. I know we don't want to do something that can be risky whenever we provide public service, but I'm here to say that with the right partners, with the right guidance, things can really can be accomplished in a stunning way to artificial intelligence and machine learning and automation.
Yeah, and there's going to be a lot of this because, like, the World Bank is dumping about $105 billion into Africa and South America to help understand COVID and how it's spreading, even in some of it's coming through its sister agencies like International Development Association or International Finance Corporation. So this is going to be ongoing, especially with the spike in the United States going from 20,000 cases per day to they're predicting 50 to 100,000 cases. Another question that kind of came up, what should the top priorities going forward in 2022 and when it comes to predictive analytics?
So I want to start that off by first let's highlight in predictive analytics what the basic steps are. So like the 7 basic, you're defining the problem, collecting the data, you're cleaning the data, you're doing the data analysis, you're building the model, you're validating it, and then there's the deployment. So my thing goes back to it's in the area of that data collection and data cleaning. But one thing that people are forgetting is we've gone through that step of in the cloud and having the data and it being accessible. We want to try to make sure that we're generating, having, and using live data, because a lot of the times where people think that when they're doing predictive analytics, it's a little too late is the best way for me to say it, is by the time they get to the data, they marry it up with additional data and they provide the results, it's just too late to do rapidly answer the call that's needed at that time. So a good example I like to talk about, give here is, for example, when as human beings, like when we get cut, our brain isn't just sitting around waiting to go check out when it feels it's the right time to go check on that cut. We feel it right away and we're able to respond right away. So that's where I think is the main thing. It's about the data and having access to that live data.
Yeah, this is such an excellent point, Zane, and that's really the key here, and that emphasizes the message that I would like to convey today is we as a federal and governmental agency need to be bold and ambitious. There is no time to waste. Data never sleeps, and the competition is fierce. So rather than having agency really work hard to frankly innovate at the margins to discrete silo-based initiatives that may work or may not work, but longer term, the underlying design patterns and the great reference architecture they put in place is not going to be sustainable. We need to have a strong investment in how to capture the data and how to better understand the data, how to increase the data sharing across agencies and across the federal government, because the most value comes from actually integrating all types of data sets, structured and unstructured. And that we need to emphasize also the need of how to trust the data we have and trust the models that we're going to be applying on that data. So in terms of AI ethics, we need to absolutely look into it and develop principles for better accountability, transparency, and reduce any bias that exists from the data, because most of the bias comes unfortunately from the data. Another thing that I will emphasize is that the data science and artificial intelligence is really an interdisciplinary field. We use scientific methods, processes, and algorithm and system to extract knowledge and insight from data sets, but to be able to better understand the data, you need the subject matter expertise needed. You need input from different stakeholders. So the first step for any agency is to create an effective data science team to be able to build a data-driven culture, not only within the team, but across the organization. And the key is to value objective data insights in the organization decision-making process. And that goes through different phases. different data maturity phases. So you have to look at the artificial intelligence as an awesome technology. But it's a transformative technology. So there is a lot of ongoing effort, but we have to be able as federal agencies to use really holistic data strategy and look for help if you don't have the skills there. There's different ways to partner up with the industry, with academia, with nonprofit, and NTIS is one way to do it. We really provide a unique and a potentially transformational way to actually help federal agency address their data priorities, and we do it in a very agile, flexible, risk mitigated approach. And we operate outside the FAR, the Federal Acquisition Regulations, so which make it help us to provide innovative framework and a very agile framework that adapts well to innovative objectives.
That's a great point. You know, understanding the basic or predictive techniques, knowing how to think critical about variables, and understanding and interpret results and validate models is a great technique. So not everybody has this skill set, but building a culture on that is very good. Absolute. I want to thank everybody. Anybody have any questions or anything about to the panel? Open it up for a little Q&A.
All right. Well, then thank you all for joining the webinar today, and hopefully we get to see you in the next one. I will have it all uploaded onto the website, hopefully by the end of tomorrow. And thank you guys all for joining, and great job on the panel, guys.